How effective is vancomycin? Have you ever wondered how effective vancomycin is for treating conditions like inflammatory bowel disease? Let's break it down. Vancomycin is an antibiotic that primarily targets certain bacterial infections. It is especially noted for its role in treating infective diarrhea. When it comes to inflammatory bowel disease, particularly for patients with primary sclerosing cholangitis, vancomycin has shown promising results. Research indicates that oral vancomycin can lead to remission in a significant number of patients suffering from primary sclerosing cholangitis associated with inflammatory bowel disease. In some clinical trials, around 80% of these patients achieved remission after undergoing vancomycin therapy. This suggests that it might be a safe and cost-effective option for this specific group. Now, for those with sensitive stomachs, such as individuals with irritable bowel syndrome or colitis, the use of antibiotics like vancomycin requires careful consideration. While it effectively targets harmful bacteria, it can also disrupt the balance of gut microbiota. This balance is essential for maintaining gut health and managing symptoms in conditions like irritable bowel syndrome and colitis. However, in situations where inflammation and bacterial imbalance are contributing to symptoms, the antibacterial properties of vancomycin may help reduce inflammation and improve overall symptoms. It is important to note that vancomycin is not typically a first-line treatment for standard irritable bowel syndrome or colitis without complications, such as primary sclerosing cholangitis. Its main application lies in specific inflammatory bowel disease cases where standard therapies have not been effective. Additionally, there have been no significant reports of vancomycin-resistant infections in patients with inflammatory bowel disease, which supports its safety profile. In summary, vancomycin can be effective for a subset of inflammatory bowel disease patients, particularly those with primary sclerosing cholangitis. It may provide symptom relief by targeting bacterial factors that contribute to inflammation. For individuals with sensitive stomachs, vancomycin could be a consideration when bacterial issues are involved. However, it is crucial that its use is managed under medical supervision to maintain gut microbiota balance and avoid unnecessary side effects. Further research is still needed to fully understand its role and long-term safety in these populations.